Hi, I'm Katie Sproul, a representative of Area Board 3 in Sacramento, California. If you're watching this video, it's likely that you're trying to establish your child's eligibility for special education services. I'm here today to discuss the different types of assessments used for just that purpose. After you've consented to or requested that your child be assessed, the district will provide you with an assessment plan. When you review this plan, you'll notice a variety of tests that address cognition, academics, communication, motor development, physical health, social-emotional development, and pre-vocational needs. There will also be a category for other assessments, which are meant to address your child's need for occupational therapy, physical therapy, and/or behavior support. If this is an initial assessment, the plan will be comprehensive, meaning that everything will be assessed. Keep in mind that initial assessments establish eligibility for special education services, while triennial assessments re-establish your child's eligibility. After your child begins receiving special education services, you can expect a comprehensive triennial assessment to occur once every 3 years going forward. Now let's talk about the types of assessments used. The most common cognitive assessment is called WISC, which stands for the Wechsler Intelligence Scale for Children. The WISC tests verbal ability, intelligence, performance, and memory. An IQ score is generated from this test, which represents your child's general cognitive ability. It usually takes between 60 and 80 minutes to administer and can be completed without reading or writing. In regards to academics, the two most frequently used assessments are Woodcock-Johnson and the Wyatt, which stands for Wechsler Individual Achievement Test. Both assessments test the broad categories of reading, math, writing, and oral language, with several subtests that address more specific areas. When testing communication skills, most districts will use the TOEFL. This measures the child's expressive language, what he or she says, receptive language, what he or she understands, and articulation. An alternative to the TOEFL is the Comprehensive Assessment of Spoken Language, or CASEL. The CASEL doesn't require reading or writing and can be administered using verbal and/or nonverbal cues. Keep in mind that if your child's social skills are an issue, the district should also look at pragmatics, which is one's ability to interact with language. To test fine motor skills, the district will most likely go with the Bruinings-Ozoretsky Test of Motor Proficiency, also known as BOT, and this will assess your child's ability to put pen to paper. Gross motor skills should be medically assessed, but can also be observed through adaptive physical education. In either instance, the district's physical therapist will often facilitate this process. The health test, which is typically the fastest test of them all, is conducted by the school nurse. Your child will receive eyesight and auditory screenings, as well as weight and height evaluations. Any medications that your child takes will also be reviewed at this time, and if needed, the nurse may recommend an outside evaluation by a medical doctor. Social-emotional testing is conducted with the Adaptive Behavior Assessment System, or ABAs. This is really just a checklist of items that the teacher completes, as well as the parent or guardian of the child, with input from the school psychologist. This is a comprehensive, norm-referenced assessment tool that can be scored with complementary software. An interpretive report is often generated and used to determine the child's strengths and weaknesses. Pre-vocational testing is administered to students between the ages of 16 and 18 who will soon be transitioning from high school to adult life. The assessment often comes in the form of a survey, which helps determine what the student's interests are as it pertains to post-secondary education and/or job placement. Tests that fall under the other category might include occupational therapy as it relates to sensory integration, physical therapy for developing gross motor skills, or a specific request for looking at behavior. This is a broad category and different for every child depending on his or her specific needs. Not all children will require testing in this category, but you should be aware of it as it may become a necessity in the future. Thank you for joining us today. For more information about assessments or additional phases in the special education process, please visit the Area Board 3 YouTube channel.